Well, you're most welcome to today's video, Sunday the 27th of August. Now, a week or two back, in fact, probably getting on for a couple of weeks back, we had Senator Rennick on the channel from Australia, Australian Senator, asking questions to these two gentlemen here. Now, these were the Pfizer representatives for Australia. And if you trust your life implicitly to the judgment of these two gentlemen, or perhaps more importantly, if you trust the lives of your husband, your wife, your mother, your father, your son and your daughter to these gentlemen, no need to watch this video. Now, these were the, what were they? Doctors. These were the doctors that Pfizer put up to answer questions. Let's just remind ourselves of the excellent question that Senator Rennick asked and the lack of a response.
Does Pfizer understand why the vaccine causes myocarditis and pericarditis? And if not, how then can it guarantee that it's not also injuring other organs? And can you explain the process why the vaccine causes myocarditis and pericarditis?
I'll take that, Dr. Hewitt.
Sure.
Based on our clinical trials and pharmacovigilance data, as well as real-world evidence following the distribution now of billions of doses of vaccine, we retain confidence, strong confidence in the safety profile of the vaccine.
Sorry, Chair, point of order. I've asked, do you understand why it causes, I know that it's a low risk, I'm asking, do you understand why it causes myocarditis? I want you to explain to me why it causes myocarditis. Do you understand why it causes myocarditis?
Pfizer is aware of very rare reports of myocarditis and pericarditis that have been temporarily associated with vaccination.
Well, that's still ongoing for some people.
Senator Rennick, Dr. Through should answer the question. Thank you, Dr. Through.
According to public health experts and regulatory authorities around the globe, the number of reports of myocarditis remains small.
I'm not referring to the number of reports. I want you to explain to me the mechanism of how the vaccine causes myocarditis. Do you or do you not understand the mechanism of why the vaccine causes myocarditis? It looks to me like you don't. And if you don't understand it, why are you saying the vaccine is safe without qualifying the risks?
So, Senator Rennick, I think Dr. Through is actually about to get to that point. Whether people agree, whether there's agreement to his evidence or not, is another question for others to make a judgment on. But if Dr. Through, if you could again go to Senator Rennick's question.
Senator, all medicines, all therapeutic products and vaccines have benefits and have side effects as well. Looking at the totality of the evidence for Pfizer's COVID-19 vaccine, regulatory authorities, health authorities, experts globally, including in Australia within the Department of Health and the TGA, have maintained that the benefit-risk ratio...
That's not the question that I asked. I asked, can you explain why the vaccine causes myocarditis? Yes or no?
Senator, the benefit-risk profile...
Yes or no? So you clearly don't understand the pathway, do you? Because you can't explain it. I'm not referring to the cost-benefit analysis here. I'm referring to, do you understand the biochemical pathway as to why the vaccine causes damage to the heart?
Senator, I'm happy to take your question on notice and come back to the committee with whatever information we can provide.
So I think we can see there that if you're answering questions before the Australian Senate and you don't want to answer the question, you just say, "Oh, put that on notice, I'll answer it in the future." Well, we've contacted Senator Rennick's staff and Senator Rennick himself, and they have given us the answer that Pfizer has given them. And that's what I want to look at now. So this is the answer to that question given on notice. So let's look at it now. And as you'll see, basically, they still refuse to answer the question. By refusing to answer this question, in my mind, they're holding Senator Rennick and his staff in contempt. And of course, that's one man, but important as that is. But the point is, he's representing his constituents in Australia. So in my view, the Australian people are being held to in contempt by these guys refusing to answer the question. And of course, I think it's probably important to remember that these are employees of Pfizer. They get paid by Pfizer, whereas Senator Rennick doesn't. Let's get straight down and look at the the response. So here's all the bits and bobs here, all the references as usual. Check it out for yourself. Now, I really hesitate to inflict this on you, but I don't think there's any way around it really. You'll be squirming in a minute, but we'll go through it fairly quickly. So that's the question. Excellent question from Senator Rennick. The mechanism of harm. They said this: vaccine safety remains utmost priority for Pfizer. We take adverse events and that are potentially associated with our vaccine extremely seriously. Well, the myocarditis is not potentially associated with their vaccine. There is a proven causal correlation. Now, if you don't believe me, let's just look at Senator Rand Paul on that now.
Is there a higher interest or a higher incidence of myocarditis among adolescent males 16 to 24 after taking your vaccine?
So thank you for the question, Senator. First, let me say we care deeply about safety, and we're working closely with the CDC and the FDA to
Pretty much a yes or no. Is there a higher incidence of myocarditis among boys 16 to 24 after they take your vaccine?
The data I've seen from the CDC actually shown that there's less myocarditis for people who get the vaccine versus who get COVID infection.
You're saying that for ages 16 to 24 among males who take the COVID vaccine, their risk of myocarditis is less than people who get the disease.
That is my understanding.
That is not true, and I'd like to enter into the record 6 peer-reviewed papers from the Journal of Vaccine, the Annals of Medicine, that say the complete opposite of what you say. I also spoke with your president just last week, and he readily acknowledged in private that, yes, there is an increased risk of myocarditis. The fact that you can't say it in public is quite disturbing.
So, Senator Paul is convinced, and he submitted the papers to support that. I'm not going to go into it now, but the evidence there is of a causal link. So a bit disingenuous there of the Pfizer Australia response. We closely monitor all such events and collect relevant information to share with the global regulatory authorities. Do you share it with the regulatory authorities? Fair enough, but why not share it with us? Anyway, does that answer the question of Senator Rennick? Absolutely not. Pathetic response, in my view. With hundreds of millions of doses of the original and Omicron adapted bivalent Pfizer-BioNTech COVID vaccines administered globally, yawn, more than 4.6 billion vaccine doses delivered, and more than 4.6 billion vaccine delivered overall, the benefit risk profile of our vaccine is well established and remains positive. For not answering the question. Not answering the question. Answer the question. To date, hundreds of millions of people around the world have received our vaccines, and serious adverse events that are unrelated to the vaccine are likely to occur at a similar rate as they would be in the general population. Really? Well, that's not what Senator Paul's comment that we've just watched said. Did that answer the question? Again, no, they're not answering the question. Why don't they just answer the question? I think I can answer the question. Which I will do in a minute, but let's carry on looking at their response. If you are still maintaining control, as I'm struggling to do. It's important to know that every medicine and vaccine has side effects. Wow, thank you for telling us that. We weren't aware of... Don't be sarcastic, I was aware of that already. However, all approved medicines and vaccines are rigorously tested in clinical trials to ensure the side effects are manageable and benefits outweigh the risks. Manageable. So the side effects are all manageable. Tell that to some of the people that we've interviewed on my videos that have been disabled. And if you think all side effects of vaccines are manageable, tell that to the bereaved. How can they say they're all manageable? Did they answer the question? No. Let me know if you disagree, but I don't think they answered the question. Pfizer is aware of their reports of myocarditis and pericarditis, predominantly male adolescents and young adults, after mRNA COVID vaccination. According to public health regulatory authorities around the world, the number of reports is small. Is it really? Tell the individuals that. Given the number of vaccines administered, patients have typically rapidly improved with conservative treatments. Yeah, I suppose that's true. Apart from the ones that haven't. And the ones that are no longer with us. And the many others that may well have suffered side effects that haven't been identified. The all-party parliamentary group in the UK estimated that only 2% of adverse reactions are potentially being reported. But they don't seem to mention that. Okay, let's move on. This is still their answer. It's unbelievable. Still haven't answered the question. Did we put a no on that one? No, they didn't answer the question then either. It's important to note that the reported risk for myocarditis after COVID-19 infection is subsequently higher when compared to when reported. Hang on, let me read this again. It's important to note that the reported risk for myocarditis after COVID-19 infection is substantially higher than when compared to reported rates for individuals without COVID infections or after vaccination. Well, I hardly know what they've said there from the forming of words, but they certainly didn't answer the question. And we've seen from Anna to Paul, it's not true in all age groups by any means. And as well as that, the thing that really gets on my nerves here is, why are we talking about COVID in the past? We're talking about COVID infections now, which are nearly always mild, especially in young, fit people. Complications that might have occurred in the Wuhan strain, in the Alpha strain, in the Delta strain, are no longer occurring now, or occurring in vanishingly small amounts. We should be talking about vaccine safety now in comparison to risk now, not risk in the past. Still haven't answered the question. In addition to following up on any clinical and spontaneous reported cases of myocarditis, pericarditis, we are conducting several large-scale retrospective database studies that assess vaccine safety, including myocarditis, pericarditis in each age group. These studies take time to accrue sufficient data to be informative, given the rarity of event. Well, we're not talking about that. You were asked, gentlemen, about the mechanism of action. Answer the question you were asked. It's a bit like someone saying to me, when were the Torpuddle martyrs? And I don't know the answer, so I say Battle of Hastings 1066. When did the First World War end? And if I don't know the answer, I say Battle of Hastings 1066. Answer the question you were asked, please. But anyway, not there. So that's a no. Right. Although a number of hypotheses regarding the pathophysiological mechanism have been put forward, this is the first time they've actually addressed the question, the pathophysiological mechanism. The research data available are extremely scarce. Well, are they really? I don't think so. I think we've looked at loads and loads of studies, post-mortem studies from Germany, for example. Meta-analysis of post-mortem studies from the United States, for example. Not really that sparse. Quite a few papers have looked at that on that. The actual mechanism of pathogenesis of this adverse event post-vaccination, or at least we're admitting it's post-vaccination here, is far from being established. They still didn't answer the question. Is that a funny way of saying they don't know or science doesn't know? It's important to note that global regulatory authorities and medical societies continue to recommend COVID-19 vaccinations. Well, they do, but we've also noticed that doesn't answer the question. So the question taken on notice, in my view, emphatically has not been answered. In my view, contempt has been shown for the Australian people, and it's completely unacceptable. But are they going to get away with it? Are the Australian authorities going to let them get away with it? Now, I'm not picking on Australia here. It's just as bad in the United States, as we saw from Rand Paul, and it's just as bad in the United Kingdom here. So what is actually going on here? Well, I think that the risk here is possibly applicable to all mRNA vaccines, and you've probably heard me talk about this before. Now, it's possible that there's some cross-immunity between the spike protein for SARS coronavirus 2 and the heavy chain of actin, which is a component of the actin and myosin contractile filaments in the myocardium. So there's cross-reactivity, that's a possibility. Why these two Pfizer doctors didn't seem to flag that up as a possibility, I couldn't possibly speculate. The next one, I couldn't possibly speculate about this either, but if you inject mRNA vaccines, it doesn't contain any antigen, so it goes into the arm, but we know the systemic distribution. And especially if there's inadvertent intravascular administration, it's going to go everywhere. But even if you give it into the muscle as supposed to, you're still going to get systemic distribution of lipid nanoparticles. They're going to go into the, maybe we could draw a picture here. They're actually going to go into the muscles, into the muscle and round about the body. Now, let's suppose that this here is one of the cells, the vascular endothelial cells, that is lining the coronary arteries. This is taking the blood supply through the heart. So we have these cells here with their individual nuclei, and these cells are lining the blood vessels that go through the heart, for example, going through the heart. So the blood would actually pass through. The blood would pass through here. The red cells would pass through these vessels. And this basic internal structure is the same regardless of the scale of the vessel. So in large arteries, they're lined with this vascular endothelium. In smaller vessels, they're lined with this vascular endothelium as well. Now, if the lipid nanoparticle absorbs onto the vascular endothelial cell, as they will, because the outside part of the lipid nanoparticle, of course, is lipid, and the cell membranes are phospholipid bilayers. So what can happen there is if you get the phospholipid particle there from the vaccine, and here we have the membrane, the cell membrane in larger magnification now, then because these form together, because the lipids form together just like bubbles, when you play bubbles with kids, then that lets the RNA into the cell. But of course, now the RNA has gone into a vascular endothelial cell. That's the problem. But this vascular endothelial cell, because it's been instructed to by the RNA from the vaccine, which has been systemically distributed, it will make the spike protein, and that spike protein will be exported onto the surface of the cell. So we end up with a situation where we have SARS coronavirus 2 spike protein on the surface of the cell. But this is the point I want to stress here, is that this will be the same with any RNA vaccine. It's not specific to SARS coronavirus 2 viral components that are synthetically synthesized by the cell. So any mRNA vaccine is going to have a degree of systemic absorption, and it's going to go into the cells of the lining the blood vessels, the vascular endothelium around the body, and this is going to happen. So this happens to be the SARS coronavirus 2 spike protein that's made by, or the analog of that that's made by the cell. But this would be the same for any vaccine. Any vaccine would be the same for that. Anyway, then the body's white blood cells come along. For example, this could be a lymphocyte here. This is a lymphocyte with a large nucleus. And this, for example, could be what we call a cytotoxic lymphocyte. Cytotoxic. And cyto, of course, means cell. These are toxic to cells. So what these cytotoxic lymphocytes can do is they can release chemicals. And rather than take out the individual antigen itself, they'll just take out the whole cell because they see the whole cell is infected. And of course, that will cause inflammation. So we could get death of a vascular endothelial cell in the myocardium. This is potentially what is happening. So because the vaccine is systemically distributed, then antigen can be produced anywhere in the body, especially in the vascular endothelial cells, as I understand this, causing the inflammatory reaction, the immune system doing its job, attacking the body's own cells and destroying the body's own cells, or certainly causing inflammatory reactions in the body's own cells. And in the heart, you don't want that. That would be called myokarditis or pericarditis in the heart. Come to think of it, you don't want it in the liver either. That would be called hepatitis. But you don't really want it anywhere. You don't want excess inflammation anywhere. So this, to me, is a fundamental weakness in all RNA-based vaccines. You can't get away from the systemic distribution, as we understand the technology so far. That means antigen can be made in any vascular endothelial blood vessel lining cell anywhere in the body. Therefore, you can get inflammation potentially anywhere in the body. Now, this is probably a fairly inconvenient piece of science to vaccine manufacturers. But I don't see any way around that. And it's a pity that these guys didn't take the opportunity to illuminate us with their science, because I would find it difficult to think that Pfizer doesn't know what I've just explained to you. This video is public domain. They're free to watch that, and they're free to respond to it. But if they didn't know that, it would be surprising. So it's a bit strange why they forgot to mention it in this written response, which, to tell you the truth, I'm not impressed with. Thank you for watching.